So medical ethics is set on some very core principles. This is autonomy, beneficence, non-maleficence, and justice. Number 1, autonomy. Patients can make their own decisions regarding their care. This is informed consent. Beneficence is us as physicians advocating for the patient and act in their best interest. This can definitely conflict with autonomy. For example, if the patient has a potentially life-saving treatment and understands the consequences and says that they do not want to have the treatment, what you have is your autonomy is now at odds with beneficence. The next is non-maleficence. This is avoiding causing injury or suffering to our patient. The last is justice. This is when we treat patients fairly and equitably. Equity is not the same as equality. Equality means you treat everyone the same across the board. Equity means that you're distributing resources and opportunities based off the needs of individuals. So for example, every patient that comes into my hospital gets their history taken and also a physical exam. However, when it comes to treatment, this will be based off the patient's specific medical needs, and this is equity. Let's talk about the obligation to treat a patient. This law was established in the EMTALA, or Emergency Medical Treatment and Labor Act. Any hospital with an ED is required to screen for emergency medical conditions, and if these conditions exist, you provide treatment until they are stabilized. But this is treating a patient in a very acute setting. Technically, a physician does not need to treat a patient in a long-term setting if the patient relationship is broken. And you can't just do this right away. No matter what is happening between you and the patient, you have to make sure that they establish care with another physician, and you have to help facilitate that transfer of care. The last thing is the legal competency of a patient. This is a legal assessment of how a patient is able to freely make their own conscious decisions. And remember, and this is very high yield, this is assessed in the court of law. Although the patient's family and the physicians involved in the patient's competency are involved in this process, physicians themselves cannot just say that a patient is legally incompetent. Let me clarify between legal competency and decision-making capacity. Legal competency is when you're talking about the patient's property or healthcare decisions long-term, but decision-making capacity, this is when a physician can functionally assess the patient. An example of decision-making capacity is when the patient has an option of choosing a more invasive procedure for an underlying condition versus just taking maintenance medications. To reiterate, a physician can clinically determine if a patient has decision-making capacity, but as far as legal competency, this goes to the court of law.